Sound check. Good morning. Hi. Ready to be awakened?
Yes.
I will perform first my dance number, then we can proceed to our regular program. Alright, good morning. So, my colleagues allocated me to give an introduction. I believe we have targeted across hospital-wide nurses to attend our grand round, oncology grand round, which is hematopoietic stem cell transplant. But for the rest of us who doesn't know what is hematopoietic stem cell transplant, then I will give you a little introduction. So, what is hematopoietic stem cell transplant anyways? One person who can answer out of oncology will have a gift. Nobody can answer, then I'll give you the answer. Alright, so HSCT is a transplantation of multipotent cells. And what is multipotent? You didn't tell us we should bring our dictionary. Well, multipotent means self-renewal, capable of self-dividing. Okay, so what is hematopoietic? Simple as blood forming. So we are getting a stem cell which will form blood eventually for our oncology, hematology patients that will be undergoing the transplant. So usually, these stem cells are derived or taken, harvested from the bone marrow, from peripheral blood, and from the umbilical cord blood of a baby. It can be autologous, meaning coming from the patient's body, or an allogenic, which will require a donor. It can be a sibling, it can be a mother, father, if they're consanguinity related, it can be sisters, or even much unrelated. It can be other person. And nowadays, we are also doing haplo-allogenic in our institution. But that will be all later on catered by my other colleagues. So, you know, the challenges is when we are explaining transplant, it's okay, boss, I will get it from here. It's failing. Subject. I will move from here.
Procedure that uses stem cells to treat a disease or condition. Currently, stem cell therapy only treats diseases and cancers of the blood. In leukemia, for example, the patient's bone marrow makes many abnormal white blood cells that can't procedure that uses stem cells to treat a disease or condition. Currently, stem cell therapy only treats diseases and cancers of the blood. In leukemia, for example, the patient's bone marrow makes many abnormal white blood cells that can't do their job.
Most of our patients, when we mention the word transplant, they are very scared. They are highly anxious because what they thought, when you mention transplant, you will be put on top of the OR table and will be open wide. So that is now the hematopoietic stem cell transplantation for everyone who is not related working to the transplant. So who is this guy? Just to mention a little bit of history with the stem cell transplant, this is Dr. E. Donald Thomas, an American doctor who have successfully did the first allogenic using a chemotherapy and radiation or total body irradiation for the patient. And he received the Nobel Prize for HSCT back in the 1990s. Speaking of history, would you like to know our history in the hospital?
Yes.
They would like to have more chocolate, maybe. Assurettes, distribute the chocolates. They are a little hypo. Alright. Going back in 2010, when we are still 9 years younger, Dr. Canada Lanesi spearheaded the first autologous stem cell transplant. Back in October 2010. Actually, it was a back-to-back event. In a matter of few days, Dr. Khalid Alanesi and the C5 nurses and the rest of the team were able to do a bone marrow for 2 multiple myeloma patients. And glad to say that one of them is still alive. Okay? Few months after around March, April 2011, again, Hematology Department Adult embarked on doing the first allogenic stem cell transplant in our hospital. We started first with a reduced intensity conditioning, meaning the doses of the chemotherapy is not full because of a lot of factors for the patient, comorbidities for example, and followed by a patient who did the myeloablative. He received the full blast of the chemotherapy doses. And good to say, until now, this gentleman who did the myeloablative is still in remission, an ALL patient, and very much alive and well today, doing a follow-up in the hematology clinic. On the same year, in 2011, at late around that year, we have our first lymphoma patient, autologous, who did a transplant. And that was under the care of Dr. Rahal in medical oncology. So medical oncology in collaboration with hematology, we did our first auto lymphoma, still in remission, alive and well, following up with Dr. Rahal. On 2012, Dr. Hani gets into the scene. He is very eagerly to test the capacity, the capability of our hospital to do an outpatient stem cell transplant. But we cannot do that in one sitting. So once in a while, we are testing the water. We did our apheresis, meaning it's the collection of stem cell, as an outpatient. Because for all those years, 2010, 2011, from the starting of mobilization until the engraftment, patient is inpatient, saying that the patient will stay for 30 days at least in the hospital. So we tested the apheresis team to collect as an outpatient. The same year, since our hospital now is having some acceleration, we joined some national and international societies related to transplant, like the European Bone Marrow Transplant Society, the Saudi Society of Bone Marrow Transplantation here in, of course, Saudi, and the Eastern Mediterranean Bone Marrow Transplant Society as well. On 2013, for the adult, okay, we're talking of the adult transplant, we had our first aplastic anemia patient. At that time, we did the bone marrow harvest, of course, together with Dr. Panayotis, Kalyanidis Panayotis. And at the same time, in 2013, Dr. Hani even pushed the boundary of starting now, the mobilization plus collection in an outpatient setting. And this one was done in the area of Mr. Osama Karesh in Oncology Clinic. So we have still lots of things to sort on, so we were not able to proceed with the Oncology Clinic to do the outpatient setting. Nevertheless, a year after, instead of sending our patients to King Faisal Riyadh for the DLI, or donor lymphocyte infusion, we have also started our own program for the DLI. This is for the allogenic patient who needs some rescue of lymphocytes from the donor. 2015, again, another test with an outpatient setting. This time, the whole process of outpatient was tested, and it was successful. It was done. The gentleman is still alive, multiple myeloma, following up in our clinic on 2015. So the first one was done again in Oncology Clinic. And also, on the same year, we collaborated with neuroscience with Dr. Rim Albunyan for our first multiple sclerosis autologous transplant, which is an autoimmune. Good morning, Ms. Wang. Welcome to our Oncology Grand Round. 2016, opening of C5 short stay under Mr. Fuad Abalrama. We have now a dedicated location for our autologous transplant. Multiple myeloma, multiple myeloma and Hodgkin lymphoma can have their autologous transplant and C5 short stay. As of the moment, we have a total of 38. 10 of those are Hodgkin, and the rest will be multiple myeloma. And of course, on that momentous year, 2016, we have embarked our hospital with haploidentical. So instead of looking at much unrelated, if the physician deemed that haploidentical can be provided for a patient, then we have offered that one. Again, with a joint effort of the whole hematology department. Oh, by the way, it's a lymphoma patient, still in remission, if I'm not mistaken, Dr. Panayotis. Yes. And 2017, our hospital, or the transplant service, also cater to collect or to help other hospitals with the collection of their stem cells. If they don't have the capacity to do it in their hospital, we are doing it for them. And also, with the leadership of Dr. Hani, we also reach out to other hospitals to teach them to do their own transplant. Instead of receiving patients as far from Jizan or from other areas like Riyadh, we also help them. We also reach out as far as Medina. And alhamdulillah, we can say that we have some hospitals that lift off because of the effort of our service here in the hospital. So this is just a little history, how our, what we can say, childhood is going around. And inshallah next year, as we embark the 10th year of our service, we will be showing up more our programs. So what are the indications, the diseases that are covered? For those who are not exposed to the transplant patients, these are the diseases that can be done a transplant. In our hospital, these are the following diseases. From the leukemias and from the lymphomas, we are doing the transplant for them. Neuroblastoma indicated for the pediatrics, they are doing that, not yet for adult though. For the benign cases, so thalassemia, Fanconi being done, of course, by the pediatric, most of them. Aplastic anemia, we are doing in adult, and autoimmune diseases like ITP and multiple sclerosis. And inshallah, in the near future, we will embark on the sickle cell anemia, which will help majority of the Eastern Province citizen. So this is the curve of our statistics for the autologous as of 2018. From 2010 to 2018, we have a steady inclination, and we have a total of 203 plus patients that have done the autologous for the last 9 years. And here's for the allogenic. For the allogenic, we have a total of 93 patients as of the moment. Now, we are here on Oncology Nursing Grand Route, CNC I, and we are here to acknowledge the contributions of different nurses who take part for this success, for this journey. Okay. First, the patient passed by the outpatient department. That will be with the adult oncology and the C5 shorts there. Adult oncology clinic, they are the one giving the initial treatment for the patient. And they're also catching the patient post-transplant when they needed some supportive care or something. So who are these people that we would like to acknowledge? These are the people under Osama Karesh. Thank you so much, ladies and gentlemen, for giving us and being tolerant to our transplant patients. When a patient is having an allogenic transplant and it's require a total body irradiation, we send them to the radiation clinics, to the radiation area. So the radiation nurses also take part of the transplant process. Now, our people from the C5 who are diligently waiting for the cases to come in, very patient, handling 5 cases is to 2 nurses. These are the nurses there. Rest assured they are doing something. They are very busy. There are instances they cannot answer telephone because they are doing something for the patient. Next one, of course, the inpatient nurses. For the adult, we have the C5 nurses. If it is a transplant, as much as we can, we put them on the C5 nurses as they are more competent and skilled, trained specifically for these kinds of patients. And we would like to acknowledge all of them for their contribution for the transplant. And of course, we have to acknowledge our technical experts when it comes to the collection of stem cells. Under the Miss Amal Al-Amri, the others are shy for the camera, so thank you, ladies and gentlemen, for the doing a great collection, giving us millions and millions of stem cells for the patient. That's it. Oh, of course, last but not the least, my colleagues and me, the Hematology Stem Cell Coordinator Nurses. So this is our humble workstation where we are being bullied by most of our patients. It's just a small area. It's in building 3, second floor. Anything we can help you out with a transplant patient, with a hematology patient, oncology in general. Rest assured, we are more than here to help you out. That's all for the introduction. Thank you.
Thank you, ma'am, for this.